happened to Hamlin that caused his heart to stop beating and how he survived.
News 8's Lisa Carberg is here with Dr. Jared Selter from Hartford Healthcare's Heart and Vascular Institute at St. Vincent's Medical Center with some answers. Lisa.
And football injuries are common, but this was different because of what happened. It was such a fluke, all about the timing of the hit, believed to be a rare occurrence called commotio cordis. Dr. Jared Selter with St. Vincent's Medical Center and Hartford Healthcare joins us now to explain. So, doctor, what is that condition that I just said?
So commotio cordis is a situation when there is blunt force trauma to the chest that delivers energy to the heart and has to happen at exactly the wrong time.
This is like lightning striking.
Almost rarer than that even. So there's multiple cycles within the cardiac event, and if this trauma happens at the wrong time, it can cause the heart to fibrillate, meaning it will just quiver as opposed to beating. Blood can't get out of the heart, and the body, including the brain, most importantly, is rapidly deprived of oxygen and will suffer injury.
Which happens fast, correct?
Immediately. So you have a brief period of time when you can start resuscitative efforts, including CPR, to artificially supply blood flow to the heart, to the organs, as opposed to the heart itself. But immediately without blood flow and oxygen supply, organs and the brain, again, most importantly here, will start having injury and start suffering.
Many people don't survive this. Why do you think Damar Hamlin is still alive?
It's clearly a tragic event and an unfortunate one, but if there's a degree of fortune here, it's that it happened at a place where it was witnessed. He had medical staff on standby there. They were there mostly for the more traditional football injuries, but they were able to resuscitate him very quickly. He had paramedics and trainers and other medical providers there who could immediately recognize the problem, respond to it, start CPR immediately. So if he's going to have a chance to have a neurological recovery, meaning a brain recovery, it's because he had immediate care.
What do you think he is going through with treatment tonight?
Since he's young and healthy, he's probably not undergoing some of the more traditional cardiac evaluations an older person with other medical problems might have, like looking at the arteries of his heart, but he's probably having modulated temperature to keep him from having fevers, having an elevated temperature, which can further the injury to the brain. Does that mean
keep him cool?
Yeah, exactly. Okay. In the past, we used to radically cool people to below normal temperatures. Now it's a narrow range of temperatures that patients are kept at, by a critical care team.
Let's talk about the importance of CPR and defibrillators. People jumped in and started CPR very quickly, and that could have been the game changer, correct?
Absolutely. If he's going to survive this and have a good outcome, it's going to be because of the people who were there. And again, he was fortunate during an unfortunate situation to have the medical providers there. The vast majority of people who have a cardiac arrest, for whatever reason, don't really have that opportunity. And we rely on bystanders who are trained in CPR and who are not apprehensive about using it to jump into action when needed.
What's the message out of all this? More people should learn about CPR, correct?
Absolutely. One of the main concerns people have with CPR is the P portion of it, which is the pulmonary. But we can do hands-only CPR. You don't need to do mouth-to-mouth, and it's a very simple training. The American Heart Association has information sites on their websites.
And we'll have it on our website, too.
Absolutely.
Excellent. Hopefully a lot of people will learn more about this. Dr. Jared Selter from St. Vincent's Medical Center, thank you for your expertise tonight. We appreciate it.